or your child has a rare disease, there is so much you cannot control. Taking charge of your needle pokes can reduce pain, stress, and make you feel a little bit mightier. I believe that everyone has the right to have a traumaless needle poke. And today I'm going to teach you how with these simple 7 steps. Number 1, prepare the brain. Step 2, calm the body. Step 3, advocate. Step 4, use the comfort hold. Step 5, block the pain. Step 6, use active distraction. And step 7, reward, refuel, and reflect. And you will leave today with a downloadable plan. Have you ever wished that you could wear this into your next needle poke? You are not alone. Needle phobia is a real and often overlooked condition. For parents and adult patients, this can make you feel invisible, angry, and even ashamed. The truth is, needle phobia is incredibly common. According to the research, needle phobia impacts over 63% of all children and teens and over 28% of all adults. When a parent isn't given the right tools, the way that a child experiences their first few needle pokes can set up a spiral of fear, which can last a lifetime. Sadly, helping patients feel safe during needle pokes is a really low priority at most medical centers. Let's face it, doctors, nurses, and phlebotomists are overworked and stretched to the breaking point. Most of them don't have the time, the knowledge, or the tools to make needle pokes easier. Not because they're not good people, but because their medical training doesn't teach them how. I would argue that for many children, needle trauma begins not with the actual pain from the poke, but from the fear of being restrained. Imagine being a child and having a stranger or multiple strangers pin you down while you kick and scream for help. Right. As most of you know, this is the traditional practice at most hospitals and labs. Thankfully, many progressive hospitals around the world are beginning to acknowledge that this is an inhumane practice. Dr. Christine Chambers, an international leader in children's pain management, says, quote, "The moment we restrain a child for a medical procedure is the moment we as health professionals have failed the child, failed to be respectful, failed to adequately prepare the child and family, and failed to implement developmentally appropriate, evidence-based fear and pain management strategies. And we've already failed when it comes to this child's next procedure because we've set up a situation that will now only get worse, not better." Why will it get worse? When you experience a traumatic event, your brain releases a host of hormones, including adrenaline and noradrenaline, which cause your body to go into a state of fight or flight, which you may have heard of. If you were facing a bear, the release of these hormones would give you a boost of superhuman energy so that you could flee, climb a tree, or do what it takes to survive. In the wild, this is really useful. But in modern life, once you've experienced a trauma, your brain sometimes gets stuck in this heightened state of alert. Living with this constant anxiety takes a real toll on our brain and bodies. In the case of a difficult needle poke, it can lead to needle phobia. Some of the symptoms can include anxiety, panic attacks, racing heart, heart palpitations, sweating, nightmares, extreme irritability, fear of restraint, fainting, and avoidance of medical care. Here's the good news. Thanks to the innovation of a few doctors who have chosen to think outside the box, it is now possible to reduce pain and fear during needle pokes so that you and your loved one can have a traumaless poke. My son Quinn, the first of my twins, was born 5 weeks early at 4 pounds 7 ounces. Quinn was born with a rare condition, which set him up for a lifetime of frequent blood draws. While the doctors shared with me all of the various risks that he might face, no one prepared me for how to handle his needle pokes. Starting at 5 days old with a foot prick, he was subjected to repeated blood draws with phlebotomists of varying skill levels. Most of them insisted on pinning him down. As I listened to his howls and witnessed his terror, I felt guilty, helpless, and mad. Although he grew to be a very funny and outgoing child, by the time Quinn was a toddler, he began to act out his fears. He spoke about being stabbed by doctors. He had violent, inconsolable nightmares. He became especially agitated before and after his blood draws. I knew in my gut that there had to be a better way, but none of his doctors had any answers. At the time, there was no Facebook group, no live support group, and no books. I felt incredibly isolated, but I refused to give up searching for a better way. When Quinn was 6, I finally summoned up the courage to walk out of a bad blood draw with a phlebotomist who, through no fault of her own, had been taken from the adult phlebotomy section and placed in pediatrics. I took Quinn by the hand and walked into the manager's office. I was terrified because I knew he needed his labs, but I also knew that I could not tolerate another awful draw. To my surprise, not only did the manager listen, but she offered to draw Quinn's blood, which she did swiftly and skillfully. Shortly thereafter, the manager hired Adrienne, a pediatric phlebotomist with a splash of magenta hair across her forehead and a huge amount of patience. Adrienne was able to get Quinn to uncurl his arm using only her voice. This was the first giant step for us towards change. The second step towards Quinn's healing was learning how to talk with him about his fear. Dr. Lily Diamond, a brilliant child therapist, taught me how to prepare Quinn for his needle pokes and how to get him to the other side when things got rough. The last part of the puzzle for me was discovering the Buzzy, a natural pain blocker. Armed with these 3 things, a great phlebotomist, the knowledge of how to talk to my son, and a pain blocker, along with several other science-based tricks that I had learned over the years, I watched Quinn's experience with needle pokes completely transform. I will never forget the day that Quinn walked out of his blood draw smiling. It was life-changing. Today at 13, he is so fearless about needle pokes. He tells me he actually looks forward to them because he knows he'll get to buy some skateboard wheels so he can skate off of impossibly high ramps. Today, I still face maternal terror, but I'm happy to say it's at the skate park and not in the lab. I founded Mighty Kids Can in order to ensure that no other human has to endure the needless suffering that my son went through. I have now had the honor of training phlebotomists, parents, and adults in how to apply these 7 steps to their needle pokes. It has been incredible to witness them overcome enormous fear. These are the 7 steps that changed Quinn's life. I believe they will change your life too. The first step is to prepare your brain. The 4 T's include timing, treats, talking, and tools. Allowing your child or yourself some small choice around a needle poke can help give you a much needed sense of control. Within the window advised by your doctor, decide when is the best time for you. When possible, give yourself a blanket of time around your needle poke to reduce any possible stress and to allow for time to decompress afterward. If it's a home injection, you might ask your child, do you want to do it before or after a meal? Before your track meet or after? Before or after a bath? And for children, you want to be firm and clear that the needle poke needs to happen, but allow them a choice, if possible, over the when. You might say, you need to get a blood draw. Would you rather go today or tomorrow? In general, the younger your child is, the harder it will be for them to tolerate the anxiety of waiting. For this reason, you want to tell younger children as close to the event as possible, while older children may prefer to know farther ahead of time. In this slide, you can see some basic age recommendations. But you know your child best, and after each poke, you may gain a better sense of the timing that works best for your child. It's helpful to have something to look forward to after a needle poke. But when I say treat, I'm not necessarily talking about a sugary treat. I'm talking about a reward that is meaningful to you or your child. Connecting a reward with a needle poke can help reassociate a negative experience with a positive. Rewards trigger the feel-good brain chemical dopamine. With repetition over time, as you begin to have better needle pokes alongside your reward, it is possible to begin to create a positive association with your needle poke. I recommend you choose a reward that's special, meaning something out of the ordinary, affordable, because you don't want to go broke, and often children expect the same thing every time. Replicable, meaning it's easy to repeat. Don't make it so fancy or complicated that it will be difficult to repeat. And age appropriate, because at each age, your child may have a different passion or interest. I want to say a quick word about sugary treats. Some families may like to give a sweet, and that is fine. I've done it myself, and it does buy you short-term love. But there are a few reasons to consider not giving a food reward. First, sugar can deplete your immunity, and we all know that it carries a host of potential health risks. Second, giving sweets as a reward can possibly link sugary foods to reward cues in our brain, and that can potentially lead to emotional eating patterns. For this reason, I personally switched from giving sweets to giving a small gift like stickers, balloons, comic books, or a visit to a favorite place. At the end of the day, you get to decide what works best for you, though. For adults, the reward can be anything that is meaningful to you. It might be as small as getting your favorite warm drink, taking a hot bath, or going to a special place. Any indulgence or anything that nourishes you. What reward would help you get through your next needle poke? Sometimes we're afraid that talking about scary things will make them worse. But the research shows that the opposite is true. While talking about our fears can lead to a temporary increase in anxiety, in the long run, it's healing. Talking about our traumas has been shown to reduce anxiety and depression and increase our resiliency. The way that we talk about needle pokes also matters. You have now heard me use the word poke instead of shot. Why? What do we associate with the word shot? Death and guns, right? So if you begin to be conscious of the language that you're using around needles, you can begin to, right there, to reduce your fear. Changing the way that you talk to yourself or your child about needles can also change the way that your brain and body respond. Instead of shot, try using the word poke or pressure or squeeze. At the same time, you never want to lie to a child and tell them it won't hurt. This will make them distrust you. You can say you'll feel a quick poke and then it will be over. For caregivers, the most important thing you can do is ask questions and listen and validate your child's experience. Asking questions sometimes leads us to learn unanticipated information and may be key to helping your child. Let them know you get that it's hard. At the same time, let them know that you're going to do things differently this time because you have new tools. This is a great time to introduce your pain blocker, your distraction, and your chosen reward, or to work out that reward with your child. We will talk in a few minutes how to pick a pain blocker and a distraction. For adults, pick an ally. That is anybody that you trust, a partner, a friend, or a therapist. Ask them for what you need, share your fears with them, and talk through your plan. Words hold power. Think about the messages that you got as a child. Were you told that you were smart or dumb, brave or fearful? With each needle poke, you have the opportunity to plant a bravery seed. Telling your child that they are brave is a great way to plant this seed. Reframing is a really useful way also to change the lens through which your child views their pokes. To reframe, start by finding the positive. What part of the experience went better last time? Was there one thing they can be proud of? Maybe they cried, but they got through it. Help your child shine a light on their victory. In 12-step programs, there's an expression, act as if. This is a really useful concept for us adults to try on. Act as if you're brave, even if you don't feel that way, and sometimes it begins to be true. Dig down deep and find the seed of your own bravery. And ask yourself, even if it's tiny, what part of me acted brave? As adults, it can be a bit harder to rewire our old thinking. But we can begin to reframe our own stories by using affirmations to buoy us through challenging moments. A mantra is a word or phrase to repeat to help you focus on one grounding idea. You might say, I am brave, or I've got this. What mantra would help you through your next needle poke? If you are going to climb a mountain, would you consider doing it without a helmet, a rope, some good climbing shoes, and a decent amount of training? Probably not. Likewise, you want to prepare for your needle poke ahead of time. There's nothing worse than adding to the stress of a poke by scrambling around at the last minute, unable to find a lab slip or something essential like your pain blocker or your medication. Trust me, I've been there. To avoid this stress, I recommend you write out or print your checklist out. Create a toolkit and organize your materials several days ahead of time. You can create a toolkit out of any kind of small backpack, fanny pack, or bag that you like. For parents of younger children, you could help your child decorate it or pick out their bag. And for teens and tweens, make sure it passes the coolness test. We have a printable checklist that you can download at the end of this webinar. Here are a few things that should go on your checklist. Your plan, your lab slip, for self-administered injections, medication, syringes, needles. You may also want to add a sharps container and some alcohol wipes, water bottle or electrolyte drink, your pain blocker, ice wings, cold pack, and warm pack for blood draws, your distraction, your touchstone, your healthy snack, and your reward, or your plan for where you're going to get your reward. Step 2, calm the body. Hydrate, exercise, eat well, and breathe. These are all ways that we can calm our bodies. We all know how important hydration is. For injections, a hydrated muscle can recover more quickly and absorb the medicine or inoculant more efficiently than a dehydrated muscle. For blood draws, hydration is even more key. Blood is about 50% water. So the more water or electrolytes you drink, the plumper your veins will be, and the easier it will be for the phlebotomist to draw your blood. If your phlebotomist is able to get the needle in but cannot draw any needle out, it's possible you're dehydrated. If this happens, I recommend that you stop, go rehydrate, and then return when you are rehydrated. Of course, check with your doctor how long it is possible to safely delay your blood draw by. And a few more hydration tips. When possible, I recommend that you opt for filtered water. Attaching a water filter to your tap can filter out harmful pesticides, lead, chlorine, and other contaminants. If you're not doing a fasting draw, drinking an electrolyte drink is a great way to rehydrate quickly. I recommend, if possible, to use an electrolyte drink that's caffeine-free and sweetened only with fruit juice. Some electrolyte drinks, which I recommend, are coconut water, which is all natural, filled with electrolytes and no added sugar. Recharge is a natural electrolyte drink that is sweetened only with fruit juice and contains no chemicals or dyes. And another option are the caffeine-free Noon tablets. That's N-U-U-N. They're convenient because they come in a small tube that you can carry in your pocket or your purse, and you simply add them to water. They contain some natural sweeteners and no added chemicals or dyes. It is well known that exercise reduces stress. Even only a few minutes of exercise can help increase our stress resilience. 30 minutes of cardio or aerobic exercise can trigger the feel-good brain chemicals called endorphins. I know, however, that it can be really hard to fit in one more thing before a morning blood draw or a vaccine or an injection. But even just 5, 10, or 20 minutes can make a difference. Aim to do the maximum that you are capable of. Be realistic, though, and do what's manageable for you. If your health is compromised, then what can you do? Do that. If you're going to a lab, some quick tips are you can take the stairs instead of the elevator. You can park 5 blocks away and walk or run. And if you're doing a needle poke at home, you can have a push-up contest with your kid. You can do stretches or yoga. Make it fun and make it doable. Given the connection between mood and food, it's helpful to be mindful of how you eat on the day of your poke. If you're having a fasting blood draw, then prepare a healthy and appealing snack for after your draw. Read the ingredients on your snacks or your child's snacks. If you can't pronounce them, they're probably not great for you. It's great to find a healthier substitute because certain chemicals can impact your mood, and that can impact how your child or you will feel going into your needle poke. While it has been found that sugar can help reduce pain in babies during needle pokes, and we're going to talk more about that later, at the same time, you don't want to eat or give your child a sugary food prior to a poke because this can actually make it harder for them to remain calm. Do you or your child get hangry? I know I do. Eating or packing a healthy snack can help stabilize your blood sugar so that no one will have a meltdown. Meditation is a fancy way to say focus on your breath. Meditating even for just a few minutes before a needle poke can promote calm and lower your stress. Some people are really skeptical of meditation. I know I personally, as an ex-New Yorker, came to it very reluctantly. But when I saw the scientific proof of how it boosts our immunity, lowers stress, and reduces pain, I became a convert. Even small children are capable of doing super short meditation practices. In fact, since younger children are more open to trying new things and listening to their parents, it's a great time to introduce it when your child is young. Tweens and teens may be willing to try it when you explain that it may reduce their stress levels during a poke. For caregivers, think about the oxygen mask on the airplane. You always have to put on yours first, right? So if you're telling your child to be calm, but your own nervous system is going haywire, they're going to feel it. Doing a short meditation on your own or with your child prior to your poke can help both of you. If you're new to meditation, there are a lot of really great apps out there that make it super easy for all ages. 2 that I like are Headspace and Spire. Headspace has a ton of child-friendly options as well as specific meditations for pain and anxiety. And Spire is more geared towards adults. You can also, of course, learn meditation from a yoga teacher or a meditation class. Step 3, advocate. In some cultures, it is considered impolite to question authority. Many of us have been taught to give deference to medical professionals, and with good reason. At the same time, it's important to remember that you are the client, and you have a right to ask questions and speak up if things don't feel right. In order to get your needs met as a patient, I believe that you need to become the captain of your medical journey. There are several things that I learned the hard way, and one of them is to trust your gut. If you don't feel heard by your doctor, your phlebotomist, or your RN, then raise your voice, respectfully but firmly. People often confuse being assertive with being aggressive, but there's a difference. Being aggressive is being disrespectful or threatening. Being assertive is standing up for what you need in a firm and respectful, clear way. You might not make everyone happy, and that's okay. If the medical provider you're working with still cannot hear you, then ask for help from a manager or social worker. For blood draws. During blood draws, I recommend that you start by locating the best laboratory available to you. If you have options, then ask your doctor, your community, or your internet search engine for the best lab or the most skilled phlebotomist they know. This can take some detective work. Once you locate a lab, call them and ask the person at the front desk who is good with children or sensitive adults. Often they'll say the diplomatic answer, which is everybody's good. In which case, I suggest that you explain that you've had some tough experiences and you really need someone who is highly skilled or extra sensitive. If you push a little, you can generally get them to give up some insider information. Always ask for a pediatric phlebotomist for children. Pediatric phlebotomists are trained to find those difficult to find veins in children, and they will do a much better job than an adult phlebotomist if you have a small child. Once you find a phlebotomist that you like, be sure to write their name down and be sure to ask for that person next time. And for your child, it's really helpful to have a name and a familiar face. Call the day before or the day of your appointment to make sure that your favorite CPT is in. And if possible, have a backup person, or ask your doctor if your person is out for that day, is it okay to wait until your favorite phlebotomist is back in? It's really important to win over your team rather than alienate them. Save your anger for your best friend or your ally. Charm will always get you farther than anger. And finally, if someone does a great job, show them your gratitude. They have a really hard job, and this can help build positive rapport between you. You don't have to spend a lot of money to show your gratitude or appreciation. Over the years, I brought our favorite phlebotomist thank you notes, flowers from our garden, and fresh eggs, multicolored eggs from our hens. This brought a tiny bit of joy to our visits. If your specimen requires any special handling, of course, be sure to alert your phlebotomist ahead of time. And share your plan with your phlebotomist so that they can partner with you. If you're using a pain blocker or distraction tools that they're not familiar with, take the time to educate them. In my experience, most phlebotomists or nurses are curious and welcoming to any new tools that will make their job easier. If you're giving or getting injections at home, at school, or work, you may need to advocate with your family, your school, or your work team. Request space if you need it. Don't be afraid to ask for help. Our family and friends often want to help, but don't know how. And now I want to say a quick word about these two photos, which are clearly the ideal we're aiming for. But I've got twin boys, and I can tell you my house doesn't look like either of these photos. And that said, how can you carve out the space and tranquility that you need to help you get as close to that goal as possible? Do you need childcare, Or can you set your kids or siblings up with a quiet activity? Or can you teach your children small ways that they can help? Don't feel bad about asking for what you need. By advocating for yourself, you will reduce stress by setting clear expectations ahead of time. Set the boundaries you need to make your needle poke feel safer. The comfort hold is a safe way to hold your child during a needle poke so that they are both physically and emotionally safe. The caregiver should always be the main person holding the child. You always want your child to be sitting upright and not lying down, because when a child is lying down, they feel more vulnerable. Sitting up gives them a sense of control. The only exception to this rule is if your child has a tendency to faint or they feel more comfortable lying down. In these photos, you can see two examples. In the top photo, the mother is hugging her child with the child facing away from the phlebotomist. And her arm is accessible, but the mother is giving her a tight hug, and the phlebotomist can help secure her arm. You always want to secure the arm both above and below on the joint, above and below the joint and where the needle will go in. In the bottom photo, the girl is sitting on her mother's lap, but facing outward. The mother can tuck her daughter's legs between hers, and she's holding one of her daughter's arms down tightly. One helper is holding her arm as well so that it's secure. The man in the photo is engaging in distraction, which we will talk about in a little bit. So that bottom photo is like a really ideal look at what you would want your needle poke to look like doing the comfort hold. Some tweens and teens may prefer to have an arm around their shoulder or on their leg, and some may prefer not to be touched at all. Respect your child's choices. Allowing them to choose how they're going to sit, how they want to be touched, and if they want to watch or not watch are all small ways to make your child feel more empowered. Touch is scientifically proven to reduce stress in all of us. Some adults may feel safer if they have an ally to accompany them. Do you have a friend or a partner who can go with you until you feel more comfortable? You may want them to hold your hand or to put a hand on your shoulder or your back. And if you or your teen is going alone, you can also bring a touchstone. A touchstone is a sacred object, prayer beads, a bracelet, or anything that holds some special significance to you. It can be helpful to repeat your mantra when touching your touchstone. Step 5, consider a pain blocker. There are 2 pain blockers that have been found to be highly effective in reducing pain during needle pokes. The first is LMX or EMLA, which are lotions that numb the skin to reduce the pain. And the second is the Buzzy, which uses vibration and cold to block pain signals from the brain. The Buzzy is a small vibrating device invented by Dr. Amy Baxter, an ER doctor who was a pioneer, being one of the first doctors to bring the issue of needle phobia to the attention of the medical world. She created this simple but effective device which works naturally to block the pain. It is now being used in over 5,000 hospitals around the world. The Buzzy is most effective when it's used together with the ice wings, which are thin cold packs that you can see here in the picture that go under it. The Buzzy can be held as the boy in the photo is doing, or it can also be attached with a tourniquet if you are not able to hold it. The cold pack goes right under it and never on the vein itself. Babies under 6 months and those with sickle cell condition should not use the ice wings. In this case, you can use the Buzzy without the ice wings. For kids and adults with fashion preferences, the Buzzy comes in the yellow and black, which is pictured here, as it also comes in ladybug red and plain black. The buzzy should always be placed between the pain and the brain. The vibration of the buzzy closes the gate on the pain signal, distracting and blocking the pain so that it cannot reach your brain. There are several pros to using the buzzy. It provides immediate relief, and there's no wait time involved. It's reusable. It requires 2 AAA batteries, which come pre-installed. It's obviously totally natural. It can be cleaned with an alcohol-based wipe, or some people prefer plastic sleeves. Some of the cons are, for some people, the initial cost is slightly higher than the numbing lotion, but the long-term cost is generally equal or less. And the cold from the ice wings is uncomfortable for some, in which case you can use the buzzy without the cold wings as well. Here are a few tips for parents and self-administered pokes. After you clean the area with alcohol, let it dry, because this will remove the sting. Relax your muscle. If your muscle is tense, the injection will hurt more. And this is a great time to practice your meditation or to take 3 long, slow breaths. If you're giving yourself injections, it can be hard to juggle using a distraction, which we're going to talk about in a minute, using the buzzy and injecting all at the same time. And for this reason, it's a good idea to use your meditation app during your poke instead of your distraction cards or your seek and find activity. For teens and adults, pain experts advise that you give the most painful poke first. As Mark Twain said, eat a live frog first thing in the morning, and nothing worse will happen to you for the rest of the day. Many children's hospitals have taken the comfort promise to reduce pain during needle pokes, and many of these hospitals recommend the use of LMX4 or EMLA. Some prefer LMX4 because it works more quickly than EMLA, but there are pros and cons to each cream, and the medical research has found them both to be effective. The pros, the way that you use the numbing lotion is, first of all, of course, always follow the guidelines. For EMLA, you apply it 60 minutes prior. And for LMX4, you apply it 30 minutes prior. You want to place a thick layer on the area that where you're going to do the needle poke, and you don't rub it in. You cover it with Glad, Press and Seal, or Tegaderm. Those have been found to be most effective in holding it in place. And then when the time is up and you're ready, you remove it and clean it and let the alcohol dry. The pros are it's effective, they're effective. For some adults and teens, some people feel like it's more discreet than a buzzy, and it's inexpensive. The cons are, for some sensory sensitive kids, there is a yuck factor sometimes with cream. There is a wait time required, so you have to plan for it. And there are some serious potential side effects and risks, which we're going to discuss. As I've mentioned, numbing lotions are widely used and trusted by many excellent children's hospitals. At the same time, there are a few precautions to be mindful of. They should be used with caution in premature babies and babies under 2, as well as patients with certain medical conditions listed here. If you choose to use a numbing lotion, be sure to use the amount prescribed for the prescribed amount of time. And of course, check with your doctor if they are safe for you or your child. Step 6, distract. Active distraction has been scientifically proven to reduce pain. Dr. Baxter has created these really helpful distraction cards, which you can see here in the pictures. Each card is designed for a different age range with a series of questions on the back. Your child can search for different things in each image. For small children, this is an example of the cow card. So on the back, it has the questions. And so for small children, the questions are pretty easy. One of them is find the purple cow. find the cows with the costumes, how many cows are in the picture. And then for older children, the questions get harder as the age range goes up. For teens and adults who might think that's not cool enough, there are more abstract pictures like this. And one of the questions for an older child or an adult is how many small black dots are above the diamonds. And so again, you're doing a search and find activity, which is engaging your brain in a way that really helps with the distraction, which lowers your pain. The active engagement of your brain doing this kind of activity creates a more effective distraction than if you were to simply look at a picture or a screen. If you don't have distraction cards or you don't want to use distraction cards, you can also count colors or shapes or objects in the room or on the poster on the wall. And the older you are, the harder you want the task to be. Where's Waldo books are also a great seek and find activity. And any game that involves blowing is helpful. Blowing bubbles or blowing a pinwheel that engages the breath and the exhalation process, which is calming to the body and is also a helpful distraction. Step 7, reward. This is the moment where you get to celebrate. Even if it was hard, take a moment to be proud of yourself and acknowledge what you've accomplished. After your needle poke, especially blood draws, it's important to refuel with a food rich in iron, folate, and vitamin C. Again, if you are on a special diet, be sure to adhere to your prescribed diet and ask your doctor which foods would be best for you to eat after a draw. You also want to rehydrate with water and electrolytes and/or fruit juice. Your last step is reflect. Parents, check in with your child and talk about how it went. Adults, check in with your ally. We are often so quick to name what went wrong, and we forget to look at our victories. For this reason, it's important to remember to look at what went right. After you name your victories, then you can look at what were your challenges and what can you improve upon for the next time. A needle poke is a little bit like a birth plan. A needle poke plan is a little bit like a birth plan. It's an ideal, and we all know that birth plans rarely work out exactly the way we envision them. Still, it's helpful to have a plan knowing that you may not hit all your goals, but even if you accomplish just a few, you will probably have made an improvement on the last time. Here are a few special considerations by age. For all needle pokes for babies, the research shows that breast or bottle feeding is the most effective pain reduction tool. That said, I know this is not always easy or possible to do, especially in a laboratory setting, or even at home if you're doing injections at home. The second option you can use is giving. Research has shown that sugar water or a sucrose solution can be helpful at reducing pain. Again, ask your doctor how to do that and what amount to give, unless your baby is premature, diabetic, or has GI issues. And then the other option is to use the Buzzy. It's important to know that if you're using the Buzzy on a baby, the baby will still cry, but their cry time has been shown to become reduced. It will be shorter, but it will be a help, but you won't see the same difference that you would see with an older child because their nervous system is not as fully developed. You don't want to use the ice wings on a baby under 12 months old if it's a single needle poke. And skin-to-skin contact helps. Also with children older than 12 months, you could have them hold the ice pack in their hand. Talk to your provider about if numbing cream is a good option for you or your baby. And you can distract a baby with bubbles or the distraction cards created specifically for babies. With babies, you want to give or request the most painful injection last. This is the opposite as it is for adults. And for blood draws, as I mentioned, request a pediatric phlebotomist, request a warm pack or bring a warm pack for their vein or foot. This can help bring the blood to the surface. And request a pediatric small gauge needle or butterfly needle, although most pediatric phlebotomists will know which needle to use. For young children between the ages of 2 and 7, children learn through play. So you see this little girl in the picture playing. One thing that's helpful is to practice with your pain blocker, practice with your distraction, and practice with play. It's both helpful to their planning minds, and it's also healing. For children 4 to 6, the research has shown that this is the age when children become most afraid of needles. And so for this reason, pain specialists suggest that you consider spacing out booster vaccinations to reduce potential needle fear. With tweens and teens, often we as parents have gotten so used to doing everything for our children that we forget that they're capable of far more than we realize. When we do things for our kids that they can do for themselves, it makes them feel less powerful than they really are. If your children are still little, you want to plant the seed in them. One day you will be in charge of your medical care. You are capable. With tweens and teens, you want to pass on more responsibility to them so they can begin to take ownership of their own health needs. Hand over this responsibility as soon as you see that your child is ready. Teens want independence, as we all know. Giving them a voice and some power over their own medical care will make them feel more confident. If your child has a rare disease, there may be some limitations on what they can manage. Let them do what they can. If your teen is not yet ready to take over, respect their lead. You want to balance supporting them with challenging them. For some primary caregivers, giving up control can be scary and hard. I know I personally am a bit controlling, and even giving up control for the greater good is not easy. Acknowledge your feelings and then take a deep breath and pass the baton. Your kid will thank you. Nelson Mandela said, "Courage is not the absence of fear, but the triumph over it. The brave man is not he who does not feel afraid, but he who conquers that fear."
All right, we are going to end there to allow Caitlin to answer any questions that you may or may not have that came up during the webinar. I know there was a few that just kind of tactical and logistical questions about the kits, but if you have any questions specifically with these 7 steps and would like to ask Caitlin, I will go ahead and just open up the opportunity for you to do that. You can type into the question and answer. You can also go ahead and unmute yourself or raise your hand.
So a little bit about me while you're thinking of questions are, I've been a nurse for about 10 years. I have been working in the pediatric emergency room, and I also work in the PACU. So I am more familiar with pediatrics and needle pokes for pediatrics. So if anyone has any questions regarding, pediatric needle pokes, or I'm not sure exactly what you guys have dealt with your loved ones or with your kids, but I know that needle pokes are a tough part of the process. So just know I'm here to answer any questions I can as someone who does this kind of on a daily basis, doing needle pokes for kids. And yeah, just want to know I'm here to help.
All right. And then there was also a question that was asked just in regards to this recording. So once this webinar has ended, you should have access to the recording, and believe that Zoom will send you a follow-up letting you know that you have access to it. We also go ahead and send out the link and provide that for you as well when I follow up in regards to your kits.
So I think a lot of questions that I get is in like the emergency room setting, are providers open to using the Buzzy? Is this something that we are familiar with? So I work at a children's hospital in Orange County, and we don't have a Buzzy in our emergency room. I think we used to, but we are such a busy ER that it's not something that we like clean or use. So having your own Buzzy, I truly think will be a game changer for your kid. A lot of nurses are familiar with how to use the Buzzy, but it's something that you can bring as a parent and just show. I know any nurse is open to anything that will help decrease pain. So just reminding the nurse that, you know, the Buzzy has to go between the pain and the brain. So you're just going to hold it, you know, on their arm if they're doing an IV in their AC. I do want to say you guys have a lot of power, and I know nurses, we like to say that I always tell my parents of my patients, like, you are the expert in your kid. I am just going to be the professional in the procedure, but you are the expert in your child. So you tell me which vein you like best and grab that Buzzy and put it on. It is really helpful. The science is really good about blocking the pain signal. I always think of it like if you hit your hand on a doorknob, like what's the first thing we do? We shake, we put ice, like anything to change the sensation of pain. So I like to think of Buzzy as like a way of changing that sensation by putting cold and also using distraction.
Caitlin, there's a question in
mhm.
the chat here that any suggestions for dealing with pre-hospital situation like an ambulance?
That's a tough one. So a lot of the times that's a challenging part of in like kids come in an ambulance, but that's the beauty of the Buzzy is it doesn't require a lot of pre-thought. It's just a tool you can have. So even in the ambulance or grabbing it as you go, it's just you could start putting that Buzzy on. As for having the chance to like take deep breaths and prep, obviously that is something that changes in an emergency situation in an ambulance, but I am a firm believer that you always have a choice to tell, even in an emergency situation, to say like, no, he likes his left arm, not his right arm, or like you have those moments to get control over where the IV is, even in high stress situations. But that is what makes the Buzzy so great. Is it's a tool that doesn't impede with time. So just putting it on there isn't going to slow down an emergency IV. It's just going to help. But yeah, ambulances are tough. I know that the firemen in our county are getting trained on Buzzy. So it's not going to be something that they've never seen, but this is where you as their caregiver and their advocate can really have a point to be assertive and be like, I want this Buzzy before you start.
Thank you for that. We have a few more questions in the chat, and I just want to let everybody know for respect to everybody's time, we will answer and follow up with these questions if we don't get to them. Caitlin, just really quickly, we have another question in the chat here. Any recommendations on how to address a nurse or other caregiver repeating, you're okay, when a child is clearly upset at a needle poke? Go ahead.
This is a great question. Like, man, this is good. I would say, obviously, it depends on, first of all, I'm sorry that your 7-year-old has to get monthly IV infusions. That's really hard. I'm really glad you're here, though. Hopefully we can help ease some of the pain. I think, honestly, you should tell, if this is the you're okay is something you don't like, I think any nurse or nurse professional, you could just say like, hey, I don't want him to think this is okay, or like this is normal. Can we use a different phrase? Or I think that this would be a great, like, show the nurse this tool, this like kit, and like let them know that, hey, can we do the comfort hold? Can we Can we try the buzzy? Don't like the you're okay is kind of just pacifying, not addressing the problem. Obviously that's like a personality thing. And I know it's even as me, someone who does IVs all the time, like I just want to be like, it's okay, it's going to be quick, but I understand that that doesn't address the pain that your child's feeling. So I think honestly, just communicate with that nurse that you want to have a better plan together for those monthly IV infusions. And I'm sorry if that doesn't answer the question, but hopefully this program will give you a little bit more tools on what to say and how to prepare. I'm in my 30s. Yeah.
Thank you, Lynn. We can definitely get to your answers right now. We're just at the top of the hour and want to respect everybody's time. But we will address both of those questions for everybody with your email addresses and make sure that we touch on those. I apologize for the lack of time. The webinar went a little bit over, but we will be following up with you. Thank you everybody so much for attending, and look forward for an email with all of the information, your follow-up questions answered, and then informations about the kits that we'll be sending out. Thank you, everybody. Thank you, Caitlin, for your expertise.
Thank you, guys.